I've kept many things private in my medical career. But this wasn't privacy. It was a secret. One that still haunts me. It started with a patient, a young woman named Sarah, 28 years old, admitted for shortness of breath and chest pain. No significant medical or surgical history. Or so we were told. She came with her parents, worried, soft-spoken, hovering. As we ran tests, something didn't add up. Her vitals were all over the place. Her heart rate was erratic, labs suspicious, and her oxygen saturation dropped without clear cause. Then came the CT scan report, and with it, the truth. Sarah had advanced stage lung cancer, unusual for someone so young. Even more unusual for someone who had never smoked a day in her life. The oncology team confirmed it. Aggressive, late, metastatic, and just as we were preparing to deliver the breaking bad news to her, her parents stopped us. Please don't tell her, we paused, stunned. She can't handle it. She's fragile. She's always been anxious. She'll give up. Tell her it's just a lung infection. We'll take her home. We'll take care of her. I was floored. I knew this was wrong. A violation of autonomy. A betrayal of trust. But they begged, cried. They said they were her caregivers. That they were the ones who would suffer if she spiraled. That she wouldn't understand. Just don't say the word cancer, please. As physicians, we advocate for patients. Always. But the attending agreed to delay disclosure just for the night. To give the family time to prepare. I thought, maybe by morning, we'll find the right moment. But that moment never came. Because Sarah asked me, am I dying? Her eyes searched mine. Wide, scared, but calm. To calm, I stumbled, I paused, and I lied. We're still waiting on some results, and we will explain everything soon. She nodded, like she already knew. That night, I couldn't sleep. I kept replaying that look in her eyes. She knew. She just needed someone to confirm it. Someone to trust. And I didn't have the courage. The next morning, before rounds, we found her unconscious. She had a full code. We did everything. CPR, drugs, intubation. But her heart never came back. 28 years old Sarah, gone. And she died never knowing the truth. Later that afternoon, the father approached me. Tears streaming down his face. Thank you for keeping it from her. We didn't want her to be afraid. But I wasn't thankful. I was numb, guilt-ridden. Because what if she wanted to know? What if she would have fought harder if she knew? What if she needed to say goodbye in her own way? I still see her face, her eyes asking, begging for honesty, while everyone around her whispered lies. Learning lessons for healthcare workers. Truth can be painful, but silence can steal a patient's dignity. Families often act from fear, not cruelty. But our first loyalty is to the patient's right to know. Advocacy is uncomfortable but necessary. Learning lessons for medical and nursing students. Ethics isn't always written in policy. Sometimes, it's found in moments when your heart and your duty don't agree. Practice having difficult conversations. Learn when to push back and how to speak truth with empathy. Learning lessons for the public. Patients have the right to their own medical information. Even loved ones don't have the right to hide it. The truth, however painful, allows people to make peace, prepare, or even fight. Silence may protect someone temporarily, but it may rob them of their final say. Closing reflection. I never told anyone what Sarah asked me that night, but her question never left me. I became a better nurse because of her, more assertive, more protective of patient truth, more willing to speak gently, but firmly. Sarah deserved to know, and I'll spend the rest of my career making sure the next patient does. We are silent scrubs. And some stories are secrets until they become lessons.